Hey, Marsh, if you have a second, sure.
Mark, can you hear me? Okay, audio is working. Carolyn, there's a question in the chat. Someone's asking, there's 3 people watching from the same computer. They're asking if there's any reason they should watch on separate devices. And also, are they able to get credit for the class for their CERT team?
Yes, this particular class is an intensive hands-on training. So what we're doing tonight is a stop the bleed awareness, actually. And there will be no official certificates issued for this class from, but we can issue credit through merits if that's possible to do. We can issue you credit through merit to say that you've taken the class, but it's not an official certificate because it's not hands-on. This is actually a very intensive hands-on class. We did a 4-hour training at the conference in San Diego, and I've done several. Got it. And I've done several of these trainings. It's very intensive hands-on, but we can't do hands-on on Zoom. So it's just an awareness. I'll give you the information and hopefully it will do you a lot of good. Okay, Patrick, do you have anything to say before we get started?
Sure. Welcome, everyone. Thank you for coming. My name is Patrick Botts-Forbes. I am the LAFD CERT Central Bureau Coordinator. Carolyn Burleson was the Central Bureau Coordinator until she decided to retire and hand the responsibility over to me in 2020. So we're glad to have her back. She was, her big thing was training and educating while she was the Central Bureau Coordinator. So I'm glad to have her on and teaching this course. So Carolyn, take it away.
Okay, good evening, everyone. Thank you for joining us. And we're going to have our Stop the Bleed. We're going to do Stop the Bleed. Am I able to share my screen, Patrick?
Yes, you're a co-host.
Okay.
And I have prevented everybody from unmuting. So if you do have any questions, please ask in the chat, and then we'll go ahead and open up the forum at the end for questions.
Okay, can everybody see my screen?
Yes, we can. Yes, we can.
You can see
Yes.
this screen?
Yeah.
Okay. All right, tonight we're going to do Stop the Bleed. And we'll cover what everyone should know, how to stop bleeding. Our objectives of this course is to describe how to keep yourself safe, first of all, recognizing a life-threatening bleed, demonstrate measures to treat life-threatening bleeds, describe actions to take before the rescuers arrive, professional rescuers arrive, and to demonstrate how to apply a tourniquet to an arm or leg, demonstrate how to use a hemostatic dressing for junctional bleeding, that's in a groin, a shoulder, or armpit, or neck, and to demonstrate how to use a chest seal and other types of means of controlling bleeding. Why do we need this course? Because it is the number one cause of death for injury is bleeding, and it's not necessary if you can stop it before it gets out of hand. And this is what we're learning to do. Bleeding can, any kind of accident can happen anywhere, at home, at work, at school, while you're driving, or some kind of natural disaster, or then you can have some crazy person with a gun. This whole training was started because of the Sandy Hook's incident with all those children that were killed by a gunman, and they decided to offer this course to teach people how to stop bleeding so that you can save lives before the professionals get there. Very first thing you do is ensure your own safety. You can't help anybody if you're injured yourself. Provide care only if the scene is safe. Protect yourself from bloodborne pathogens. We'll talk about that. Excuse me. And if any time you feel yourself threatened or the scene becomes unsafe, you have to attempt to remove yourself and the victim, if possible, from danger and find a safe location. Okay, we're going to cover the ABCs of bleeding control. A is alert. Call 911. That's the very first thing you do. Call 911 or have someone call 911. Get help coming on the way as soon as possible. B is to find the source of the bleed. And C is to compress, apply pressure. Body substance isolation. Anything that is body fluid should come from someone else's body. If it's warm, if it's wet, if it's not yours, don't touch it. Wear latex gloves, non-latex gloves. Wear safety goggles or glasses. Wear a face mask. And in this day and age, with COVID still going around, it's better to wear an N95 mask than this kind of surgical mask. If you're treating, you're getting close up on someone. If the person is conscious, you must identify yourself and ask permission to assist. You're not allowed to treat anybody without their permission. If they say no, you can't help them. You might want to try to convince them that you can help them and what their condition is life-threatening and you can save their life, but if they still say no, you have to let them go. They won't even treat them in the hospital without permission. So you're not allowed to treat people without permission. So that's the first thing you do. If the person is unconscious, permission is implied. So you can go ahead and treat. Okay, so first thing you do, alert, call 911. Second, bleeding, find the source of the bleeding. Open and remove the clothing over the wound so you can clearly see it. And identify life-threatening bleeds. Remove clothing, you can see the injuries that may be hidden under the clothes. Types of hemorrhages are a capillary bleed, that's just that's non-life-threatening, that's just like an abrasion, a scrape or something, or just a mild cut. But blood that's flowing from a vein, you'll see it is dark and it is a constant steady flow and it's dark. That's a life-threatening bleed. Blood that's coming from an artery, it spurts, it's under pressure. So every time the heart beats, it's going to spurt the blood out. And of course, you don't want that to happen. Your blood's supposed to be pumping throughout your body to send oxygen to your organs and all throughout your body, but not supposed to be outside the body. So if it's spurting, that's definitely a life-threatening bleed. Okay, A, alert 911, call 911. B, find the source of the bleed. C, compress. Apply pressure to the bleed. 90% of bleeding can be controlled by direct pressure. You hear that? 90% of bleeding can be controlled by direct pressure, but you have to put a hard pressure on it. Cover the wound with a clean cloth and apply pressure by pushing directly on it with both hands, like you're doing CPR, except you're not pumping. You're going to press down and just hold it. And you could, you can do that by, that's direct pressure, or you can use a tourniquet, or you can pack or stuff the wound with a hemostatic gauze. We're going to go into each one of these techniques. Okay, a number of different methods you can use to stop bleeding, but all of them have one thing in common. You're compressing a bleeding blood vessel. That's the main thing you're trying to do in order to stop the bleeding. Direct pressure, or tourniquet, or wound packing, either one of those things. Okay, I have a little video to show you here.
And it's the first order of business. And it's hard. How do you know if you're stopping it, there's no more bleeding?
When someone is bleeding to death, you're in a very short window of time that can easily be way shorter than the fastest first responder could get there. If you happen to be in a place where there's another individual that's been trained, all of a sudden we have a way to get the right medicine to prevent your death to you, and we have a life saved.
We're trying to get out basic information on how to stop bleeding by the use of tourniquets or use of gauze or hemostatic agents. Teaching the public this stuff is huge because I'm also a full-time law enforcement officer, and it does take us time to get to incidents. So, you know, the crucial minutes or the first few minutes of when something happens, and any civilian can be a lifesaver by stopping that bleeding. The tourniquet's going to be placed up high, closer towards the groin, not close to the injury site. And what we want to do is just bring this around, come back through the buckle, pull that tight as best we can. And then we use the windlass that's on here. We're going to tension this down to the point at which the bleeding stops, right? So people will ask, how many turns do you do? That depends. And we're just going to do this until the bleeding itself stops. Once we see the bleeding has stopped, we're going to put a time on there to show what time this tourniquet was applied. And then we're going to move on to check the victim for any other injuries.
This is about making a decision to be able to intervene if you have the opportunity.
You can actually put this over your arm like this. And we teach this in the military for law enforcement. Yep, slide it up, throw it on quickly, and secure it.
Just like when we pushed hard to teach people CPR when they encountered someone who had cardiac arrest, we want to push this training out, these interventions out, because it's felt that these interventions can be learned by non-otherwise trained bystanders or civilians and applied appropriately.
So for wound packing, so if it's a gunshot wound or it could be some sort of a penetrating trauma wound, this is where we want to take some sort of gauze, or it could be a hemostatic agent like Quick Clot that helps stop the bleeding faster. And we want to take this product and we want to try to press it down into the wound cavity and hold pressure. And then what we're going to do with the rest of it is we're going to continuously push pressure down into that cavity and fill it up. And it causes what they call a tamponade. It overcomes the pressure of that artery. I'm just going to keep doing it until it starts coming out the top. I'm going to put pressure on it afterwards. Once you do that, you use something like an ACE bandage is great if you have it. This is a pressure dressing. This just goes over the top and then secures around the actual wound. We just want to basically keep going around, and that's going to hold that in place and hold the product down inside that wound cavity, keeping pressure on it. The big hope is that we can train as many people as possible. Programs are held through here, through Harvard Hospital. Programs are held, American Red Cross. There's a number of first aid programs that talk about bleeding control and this sort of thing. And this is a life skill. This is no different than if you should be able to swim to save your own life. You should be able to stop bleeding. It should be a life skill. This shouldn't be something that's optional.
Okay, very important skill to know to be able to stop bleeding. Okay, commercial stop the bleed kits. You will find them in airports and in some public or commercial buildings. Usually they place them where they would put an AED machine. You'll find them next to the AED machine if they have them. Not all places have them, but if you're in a public place like a mall or something or a public government building, they would probably have these, and you would look for them. What you will find inside, you will find tourniquets. You'll find some trauma shears. You'll find gloves to wear. You'll find these over here are Israeli bandages. I'm going to talk about those. Quick Clot or a hemostatic dressing and a chest seal. That's what they put in the commercial. Stop the bleed kits. And this is what you'll find inside. What I would add to mine, if you're making up your own, I would add a triangle bandage. I would add gauze rolls. I would add ACE bandage, a face mask, of course, a Sharpie in order to mark your tourniquet, an ER blanket, one of those space blankets, and alcohol wipes, plastic bag. I would add all of this to my own. Okay, if you have a trauma kit available, apply direct pressure to the wound. If you don't have, I'm sorry, if you don't have a trauma kit available, you first thing, you just apply direct pressure to the wound. Take any clean cloth and cover it. If the wound is large and deep, try to stuff the cloth down into the wound. Apply continuous pressure with both hands. Like I said, like you're doing CPR, only you don't pump, you just press down hard directly over the wound and push down as hard as you can, and you hold pressure until the medical responders arrive. Now, what if there's more than one person that you have to treat? And certainly are often dealing with triage conditions where you have to treat more than one person. And so this is where a pressure bandage comes in. If you
Carolyn,
yes.
there's a request to just slow down just a little bit. People are trying to take notes.
Oh, okay. All right. So if you're trying to stop the bleed and there's more than one person that you have to treat, then what you have to do is you put direct pressure over the wound, then you have to put something on it to hold the pressure so you're able to move on to another person. Okay, so this is where the pressure bandage comes in. You use an ace bandage, or a roll of gauze can do the trick too. You wrap it around the wound, you put the dressing on, and then you wrap the bandage around the wound directly on top of it. Each time you wrap, every other wrap, you're going to twist it like it's shown in the picture, and you wrap and twist, you wrap and twist, wrap and twist. And each time you do that, it exerts more pressure on the wound, and it becomes almost like a cast. It gets hard, almost like a cast when you do that, and it holds pressure directly on the wound. So you can do this in order to be able to move on to another person if you need to. Okay, another form of direct pressure is an Israeli bandage. These are bandages that they issue to soldiers, and I assume it's called an Israeli trauma dressing because, oh shucks. Sorry. It's called because it originated in Israel, but this is an excellent piece of equipment to have in your toolkit, because you can apply direct pressure right on top of the wound with this, and I'll show you a video to give you more information on how to apply it.
Every year, Queensland paramedics attend to thousands of trauma patients. Part of our job as a paramedic is the identification and management of patients with serious and life-threatening hemorrhages. The introduction of the new emergency bandage, or Israeli bandage as it is otherwise known, will help our paramedics to better control external hemorrhage in the field. The following is a short collection of videos that will demonstrate to you the appropriate application of these bandages in a number of situations.
To dress a neck wound, remove the bandage from the packaging. Raise the patient's opposite arm above.
Yeah, I just stopped for one moment. This Israeli bandage has, oh gosh, what is, sorry. Okay, the Israeli bandage has a dressing built into it. So you put the dressing directly on the wound, and then they show you how to wrap it.
Every year, Queensland paramedics attend to thousands of trauma patients. Part of our job as a paramedic is the identification and management of patients with serious and life-threatening hemorrhages. The introduction of the new emergency bandage, or Israeli bandage as it is otherwise known, will help our paramedics to better control external hemorrhage in the field. The following is a short collection of videos that will demonstrate to you the appropriate application of these bandages in a number of situations.
To dress a neck wound, remove the bandage from the packaging, raise the patient's opposite arm above the head, and place the dressing pad over the wound. Now wrap the bandage leader around the body and into the armpit opposite the wound. Insert the bandage through the pressure applicator and pull back to tighten. Continue bandaging around the body through the opposite armpit to keep the bandage away from the trachea. Fasten the closure bar at any convenient point on the bandage, and then lower the raised arm to increase pressure on the wound and further distance the bandage from the trachea. Remove the selected bandage from its packaging and place the non-adherent pad over the wound, positioning the wound between the pressure applicator and the label. Wrap the bandage leader around the head. Insert the bandage into the pressure applicator and pull back firmly in the opposite direction to lower the pressure applicator over the wound and continue bandaging. To turn the direction of bandaging, hook the bandage leader behind a corner of the pressure applicator and wrap the bandage under the chin and over the patient's head. Fasten the closure bar at any convenient point on the bandage. Remove bandage from packaging and place the dressing pad over the wound. Wrap the bandage around the limb and insert into the pressure applicator. Now firmly pull back the bandage in the opposite direction and continue bandaging. Fasten the closure bar at any convenient point on the bandage. Now for severe uncontrolled hemorrhage, additional pressure can be applied. Insert the closure bar between the last 1 to 2 bandage layers and rotate to apply focused high pressure over the wound. Now fasten the closure bar at any convenient point on the bandage.
Okay, you notice that the Israeli bandage and the ACE bandage, that they both apply direct pressure. Both of them apply directly on top of the wound. Okay, if we were doing an in-person training, we would stop and practice each one of these skills on each other, but we can't do it here. So all I can do is show you basically how it's done. All right, the next is to compress using a tourniquet.
Did you know that traumatic injuries are the leading cause of death for people under age 40? And that some of these deaths are preventable? Blood loss is responsible for 35% of pre-hospital deaths. And during mass casualty events such as shootings, 80% of victims are delivered to hospitals by someone other than a trained ambulance crew. Severe bleeding can lead to death in 5 minutes or less. Many people perish before an ambulance can arrive. But it doesn't have to be this way. It's time to stop the bleed. And you can be part of it. Stop the Bleed is a White House initiative that provides people like you with tools they need to take action against life-threatening wounds. In this brief video, we'll show you how to get involved.
Everything was so normal. We were just going about our day, minding our business. But then there was this noise, like a loud pop. People were running and screaming, and then I saw people just lying on the ground, bleeding.
What if this happened to you? Would you know what to do? Here are some initial pointers. Act quickly. What you do in the first few minutes is critical. Evaluate your safety. Is it safe for you to remain where you are? If not, evacuate the area. Tell someone to call 911. Apply pressure. Pressure is what stops bleeding. Let's explore the concept of pressure more. There are two basic kinds of pressure: direct pressure and pressure applied via a tourniquet. There are two main ways to tell whether bleeding is serious enough to require a tourniquet: the volume of blood and the flow. Volume refers to the amount of blood present. Think about a soda can. Cut that amount in half. If that amount of blood is present, then it's serious, life-threatening bleeding. Another warning sign is flow. If the blood is squirting, pooling on the surface, or if it's flowing continuously, then it's serious, life-threatening bleeding. In a real-life scenario, you'd evaluate the volume and flow of blood to help you make decisions.
This person's arm is injured, but it looks like neither the volume nor the flow of blood indicates we need a tourniquet. We need direct pressure instead. You, call 911. This person's injuries are more severe. There's more blood than half a soda can, and it's flowing really fast. That means I need to use a tourniquet to apply pressure.
So you've decided you need a tourniquet. What next? You need to find or make one. Two basic types of tourniquets are out there: commercial and makeshift. Commercial tourniquets are the most effective. If you're in a public facility, you may be able to find one in a bleeding control kit, often found near an AED display. If that's not an option, apply strong pressure with your hands or use available materials like a t-shirt or towel. Tourniquets are used for severe bleeding on arms and legs, not other parts of the body. The key idea is only the limbs. Apply direct pressure to stop bleeding on other parts of the body. In this video, we'll focus on pressure applied via a commercial tourniquet. Place the tourniquet 2 to 3 inches above the wound. Be careful to place it above the injury, not directly on top of it. Then, simply pull, twist, and clip. Pull the free end of the Velcro strap, thread it through the buckle, and securely fasten it back onto itself. Twist the rod until the bleeding stops, or until you can't twist anymore. Note that this step will be painful for the injured person. Be persistent. Be sure that the bleeding stops. Clip the rod with the small Velcro strap, securing it so that it doesn't untwist. If bleeding continues and you've tightened the tourniquet as much as you can apply a second tourniquet above the first, closer to the torso. Although applying the tourniquet is simple, watch out for these common mistakes. Mistake number 1, not knowing when to apply a tourniquet. Tourniquets aren't appropriate for all injuries. Don't use it for a minor injury or on the trunk of the body. But for life-threatening bleeding on the arms and legs, don't be afraid to use a tourniquet. Mistake number 2, not tightening the tourniquet enough to stop bleeding. Also, remember to keep twisting until bleeding stops. If it doesn't stop, add a second tourniquet closer to the torso, above the first tourniquet. Mistake number 3, placing the tourniquet directly on top of the wound. The tourniquet should go just above the wound, on the side closest to the torso. Mistake number 4, loosening the tourniquet. Leave the tourniquet on until medical professionals arrive. Even if the victim complains of pain, the victim could bleed to death quickly if the tourniquet is removed. Hopefully you'll never have to apply a tourniquet, but knowing how can save a life. Thanks for helping stop the bleed. This message was brought to you by the National Center for Disaster Medicine and Public Health at the Uniformed Services University of the Health Sciences.
Okay, that shows you how to apply a commercial tourniquet. And this is a makeshift tourniquet that you can make with a triangle bandage that you put into a cravat, folded into a cravat, a necktie, any kind of cloth about 1.5 to 2 inches wide, and a stick or a pin or whatever you can use to twist it. But commercial tourniquets are by far the most effective. But if you don't have one and you can make one, and you're maybe out somewhere and this is all you have, then this is what you work with. But you apply it again 2 to 3 inches above the wound, not on top of the wound. You place a bandage of a dressing on top of the wound. Oh gosh. Sorry. You place a dressing on top of the wound and you hold it to apply pressure, but then you put the tourniquet 2 or 3 inches above the wound and you twist it until the bleeding stops. Now, bear in mind, when you're applying a tourniquet, it's going to hurt like the dickens. Okay, the person will probably scream. But if their life is threatening and they're threatening to bleed out, better let them scream than die. Okay, but talk to the person and explain to them that this is going to hurt, okay, but it's going to save your life. Let them understand that. Okay, but and don't have mercy because they scream that it hurts, because if you don't tighten it tight enough, it's not going to stop the bleeding. So that's something you have to consider. Okay, junctional bleeding, that's bleeding from the armpits or shoulders, the neck, or the groin. You cannot apply a tourniquet to a junctional bleed, of course. And so this is where you do wound packing with a hemostatic gauze. Hemostatic dressing is a dressing. A hemostat is an agent that controls bleeding by allowing the blood to clot faster. So that's, you can buy a gauze like what do you call it, Quick Clot or Celox, any of those that have a hemostatic dressing infused in them. But that's what they do. It causes the blood to clot so that the person won't bleed out. So this is what you would use. If you don't have a hemostatic dressing, use any kind of gauze. Or if you don't have that, just a clean cloth to pack the wound so you can apply pressure. And remember, you're applying pressure to a blood vessel, so you have to pack deep. The blood vessels run alongside of bones. The veins and arteries, they run alongside of bones. They're deep in your body, so you have to put pressure hard on them. Okay, these are examples of hemostatic gauze. Quick Clot is the civilian version. The combat gauze is the military version, but it's the same thing. Celox Rapid, Chitoflex, or Chito gauze. These are all commercial types of hemostatic gauze that you can purchase. Wound packing and direct pressure. For life-threatening bleed to an arm or a leg and a tourniquet is not available, or for a life-threatening bleed to the neck, shoulder, armpit, or groin. This is where you would do the wound packing. You pack and you stuff the wound with the bleeding control gauze or whatever you have, but pack it deep and pack it hard. And put both pressure, once you pack the wound with all that will fit in there, when you probably have some left over, you just pile it on top of it. And then cover it with an ace bandage or gauze to hold it in place. But you have to first find the source of the bleed. Remember that. A, call 911. B, find the source of the bleed. And C, to apply direct pressure, compress the blood vessel. You want to pack the wound with the bleeding control, the gauze or a clean cloth, and you're just going to hold it in place. And this is very important that you pack it, and you pack till you can't pack anymore. Just get as much as that deep down into the wound. This is for a large wound, of course, and you pack it until you can't put any more in there, and then whatever's left on top, you just pile it on top and wrap it with an ace bandage or Israeli bandage or whatever gauze you have to hold it in place. Internal bleeding to a chest or an abdomen, you can't do anything about bleeding that's going on inside the body. Okay, so all you can do is get the person to an emergency room ASAP. That's all you can do. Any injury to the chest or abdomen may cause severe bleeding inside. It may not be an open wound, but you can tell that it's bleeding on the inside because you'll get it'll form a very large contusion, a very large dark bruise. And that's how you can tell if it's bleeding inside. It gets hard. Usually if you touch a person's abdomen, it's soft, okay? But if they're bleeding inside, it'll get hard and it will bruise. So, but you can't do anything about that. Just get the person to the hospital as soon as possible. Okay, this is an open abdominal bleed. You can do something about that. You can't pack it because remember, the purpose of packing and the purpose of direct pressure is to put pressure on the blood vessel. This, on an abdominal bleed, let me go to the next slide and show you. Your blood vessels are deep within your body, and all of your organs, your vital organs are covering them up, so you can't reach them. If they're bleeding and it's an open wound, you won't be able to find the blood vessel to compress it. So the best you can do is cover it up, okay, like this, and then wrap it with a plastic wrap and form an occlusive dress and get that person to the hospital ASAP. Okay, the next is a penetrating chest wound. And for that, you use a vented chest seal. Penetrating chest wounds can be caused by gunshots, knife wounds, stabbings, or any kind of puncture wound. And it prevents the airflow into the chest cavity. When you're breathing in through your lungs. You don't want air coming into your chest through any other source except through your lungs. But if you have an open chest wound, you may be getting air coming into your lungs, and it can cause your lung to collapse. And that's why they call that a sucking chest wound, as you can see in this video here.
Penetrating chest trauma can be immediately life-threatening and needs urgent medical intervention. This is particularly the case where the wound communicates with the chest cavity, causing an open pneumothorax, potentially collapsing the affected lung. The lungs are normally soft and compliant and fill the pleural cavity. On inhalation, the intercostal muscles lift the rib cage, expanding it and creating a negative pressure. With an open airway, the lung expands to fill the space. This is assisted by the muscular sheet known as the diaphragm, contracting and flattening, also enlarging the chest cavity and expanding the lungs. In open pneumothorax, a wound creates an open passage between the external environment and the pleural cavity. Air can potentially pass in and out of the chest cavity through the hole in the chest. With the loss of negative pressure in the pleural space, which would normally hold the lung in an expanded state, the lung on the affected side will now collapse. With inspiration, the rib cage will expand and the diaphragm flattens, but the negative pressure may now pull air into the chest cavity through the hole in the chest wall. Depending on the size of the wound, the affected lung may partially expand or may remain completely collapsed. The effect of air being drawn in through the hole in the chest has led to the term sucking chest wound, though this movement of air may not always be obvious. Treatment of open pneumothorax involves applying a seal to the chest, which, by means of a valve, will allow blood and air to be expelled during exhalation, allowing a negative pressure to be created and the lung to reinflate. The patented Russell chest seal represents a state-of-the-art dressing designed by leading trauma experts for this specific purpose. It has a valve designed to open with a small positive pressure gradient and with sufficient capacity to allow a high flow of air and fluid to pass through it. 4 apertures allow this to happen efficiently and with minimal risk of obstruction. On inhalation, even a small negative pressure will make the valve close, even in the presence of fluid such as blood. The Russell chest seal has no latex parts and is designed to remain highly occlusive in order to make an effective seal. By incorporating a hydrogel-based dressing with a breathable outer layer, the dressing can remain highly adherent even on a patient with hairy or sweaty skin. The Russell chest seal is a safe and easily applied dressing that can be incorporated into the most basic of first aid measures.
Okay, now that was a commercial chest seal. You'll find the hyphen chest seal, which is another brand. That's what the one you'll find most common here in the United States. I think that was video was made in Britain, but it's the same principle. However, if you don't have a chest seal handy, you can do the same. You can achieve the same objective with a piece of plastic, just sealed on 3 sides. You apply it to the wound. When the person exhales, you'll put the piece of plastic over it. And then when they inhale, they'll suck the plastic over the wounds. Instead of air going in, it'll hold the plastic in place. And you seal it around 3 sides. So when they breathe out, the air will come out, but they won't breathe any more air in. So that's keeping the air from going inside the chest cavity. It should only be going through the lungs, not through any other opening in your body inside the chest cavity. And this will keep the lung from collapsing. So this is an important measure to take if a person has this kind of wound, and then get them to the hospital again, ASAP. None of these measures are designed to be the end result. These are all the beginning result. This is your first aid trauma, the way you handle the trauma of bleeding, first aid. Your job is to turn the person over to the medical professionals, turn them over to the EMS when they arrive, but you want a live body to give them. You don't want somebody to be dead before they arrive. And you can be the one that can cause that person to still be breathing when the medics get there. So that's an important thing to know. So we've covered the pressure bandage that you can do with an ACE bandage or gauze. We covered the pressure bandage you can do with the Israeli bandage. These are direct pressure right on top of the wound. We cover the tourniquet, which you put 2 or 3 inches above the wound, never a tourniquet on a wound. And you never do you apply a tourniquet on top of a joint. So if a person has a place on their arm that's bleeding severely and that requires a tourniquet, you will have to place it above the elbow, okay, closer to the torso, and never apply it on top of a joint, the closer to the torso. Of course, if you can't stop the bleeding with one tourniquet, you can put another one on there, but do it and twist it as hard as you possibly can, until the bleeding stops. And then you notice that you put that little seal over across to hold the windlass in place. But that's where you mark the time that you place the tourniquet on. So by the time the person gets to the hospital, they know how long the tourniquet has been on the person's body. Okay. Impaled objects, improvised tourniquets, we just talked about that. A loss of an arm or leg. Any other questions? Let's talk about impaled objects. If a person has an object that is impaled and sticking out of their body, it could be on their hand or any part of their body, you are never to remove it. Leave it there, pack around it with a thick dressing around the object, and then bandage around it to hold it in place. Never take it out, because when you pull it out, it may be applying pressure on an artery, and you pull it out, and then all that pressure is relieved, and then the blood will flow. So you're causing more harm than good. Just leave it in place and pack around it, and then bandage around it to hold it in place and get the person to medical care. If you have a severed body part, that's something you hope you never have to deal with, but it's a possibility. Keep the severed body part, just cover it with a clean cloth and put it in a plastic bag. Okay, and then you can put the plastic bag in ice water, but never put it directly on top of ice. Never ever. Put it in a plastic bag, and then you can put it in an ice water bath. And of course, you want to keep the severed part with the patient, so when they go to the hospital, their modern medicine can attach it back again. Isn't that wonderful? So this is what you do. Do not put the severed body part on ice. Put it in a plastic bag, and then you can put ice on it. Don't use dry ice, because that can cause it to get frostbite. Okay, these are basic steps. Apply pressure with the hands, apply dressing and pressure, wrap, wind, secure, and time. That's what you do with a tourniquet. Okay, this is just the basic steps you go through. Again, to review. 1, alert 911. That's always the first thing you do. You want to get them on the way. You want to get help on the way. B, find the source of the bleed. Look for a life-threatening bleed. C, compress the bleeding blood vessel. Okay, that's basically what you do. If you don't have a trauma kit, use any clean cloth that you have and apply steady pressure directly on top of the wound. If you do have a trauma kit, and you can use a tourniquet if the situation requires it, on an arm or leg, never on the torso, never on the groin or shoulders, on an arm or leg. That's where you use a tourniquet. And you apply it above the bleeding site, 2 or 3 inches above the bleeding site, and tighten it so that the blood flow stops. If you don't have a tourniquet, then you use wound packing. Or if it's not accessible with a tourniquet, that's when you pack the wound. Pack it deep and fill it up with as much as you can, because you're trying again to get to the blood vessel itself. That's what you're trying to compress. Okay, here's some apps that I can recommend you to download. Number 1, there's a Stop the Bleed app. Get that on your phone, because it goes through the procedures, and just to remind you how to use a tourniquet and how to pack a wound. There's an app called Just a Compass, and it does nothing except it gives you the address and the GPS coordinates where you're located. If you happen to be in a place that you're unfamiliar with and you have to call 911, the first thing they will ask you is, where are you? And you want to be able to give them an exact address. Okay, so having something like this on your on your phone that you don't have to go searching through the map to find it. It'll give you the address where you're located, and it'll give you the GPS coordinates. And there's another app called What 3 Words. Somebody, I don't know who, group of people divided up the whole world in grid squares of 10 square feet. And you can, with that app, you can identify where you are within 10 square feet of where you're located. And it will give you the coordinates with it, with those 1, 3 words. So that's something to consider anyway. Okay, ready for a little quiz. I'm not going to, you can unmute yourselves now. I'm not going to be able to see your hands, but I'm just going to go through this quiz. Okay. Answer for the following question. The first step in bleeding control is A, perform CPR.
911.
Say what?
B.
Okay, just to find the source of the bleed. You can't control it unless you find where it's coming from. 911 is the first step you do before you start to control the bleed. But the first step you do. Say again. Okay. The answer is B, find the source of the bleed. Okay. Some examples of a life-threatening bleed. Blood that's spurting out of the wound. Blood that won't stop coming out of the wound.
All of the above.
Pulling.
D, all of the above. E.
Hey, can everybody wait for Carolyn to read the questions and all of the answers and then answer?
Okay, the answer is all of the above. That's correct. All indications of life-threatening bleeds. Retreating threatening bleeding from penetrating junctional wound. Open the cloth over the wound, wipe away pooled blood, and then what? Push down as hard as you can. Apply steady pressure with both hands directly on top of the wound. Pack the wound with bleeding control gauze, plain gauze, or clean cloth. Continue to hold pressure until medical response arrives.
C.
Okay. The correct answer would be C. Pack the wound with bleeding. Okay. When applying a tourniquet to an arm or leg, you should place it over the nearest joint, as close to the wound as possible, where the patient says is most comfortable, at least 2 or 3 inches above the bleeding site.
D.
At least 2 to 3 inches above the bleeding site.
Yeah, 2 to 3 inches above the bleeding site. Okay, when treating bleeding from a penetrating extremity, without a trauma kit, you first take a clean cloth and cover the wound. Then, A, apply continuous pressure with both hands directly on top of the wound. Pressure until relieved by the medical professional. Push down as hard as you can. Try to stuff the cloth down into the wound.
G.
A, B, and C.
B.
A.
Okay,
A.
try to stuff the cloth down into the wound.
Oh, penetrating. Yep.
Once you've secured the windlass of the tourniquet, to keep it tight, you should always note the time the tourniquet was applied. True or false?
True.
Nothing to do
True.
with the tight.
Okay, if the victim is in pain, the tourniquet is on too tight. True.
False.
That's false. If the victim is in pain, that means you're doing it correctly. If you're not in pain, put it on tight enough because it's going to hurt. Okay. I'm going to show you a series of pictures. I want you to tell me what you would use to treat this particular type of wound. Direct pressure, wound packing, a tourniquet, or a wound seal.
Ooh.
Tourniquet.
Direct tourniquet.
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 The victim is in pain. That means you're doing it correctly. If you're not in pain, it's on tight enough because it's going to hurt. That's definitely a tourniquet. Okay. I'm going to show you a series of pictures. And I want you to tell me what you would use to treat this particular type of wound. Direct pressure, wound packing, a tourniquet, or a wound seal. That playing back.
Tourniquet.
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 That means you're doing it correctly. If you're not in pain, it's on tight enough, but it's going to hurt.
Direct pressure.
That's definitely a tourniquet.
Direct
Okay.
pressure. Direct
I'm
pressure.
going to show you a series of pictures. I want you to tell me
What in the world?
to treat this particular type of wound. Direct pressure, wound packing, a tourniquet, or a wound seal. That's fine.
Pressure.
Direct pressure.
Now I can't hear her.
What was the right answer? With all that noise, I couldn't make it out.
The thing was playing what I was saying.
I can't hear a word she's saying.
Carolyn, try now. I muted Kirk, who sounded like he was causing an echo. Try and talk now, Carolyn.
Maybe she should put the answer in the chat. It's just so much talking, everyone.
Yeah, what was number 2? Yeah.
Back to number 2.
What was number 1?
Tourniquet.
Tourniquet.
Okay.
This is number 1. That's a tourniquet. Number 2.
Direct pressure.
Direct pressure. Wound pad.
Let her answer, please.
Okay. Number 2, direct pressure.
Okay, there we go.
Number 3.
Yeah, not the shit. Packing.
Packing.
No, you stabilize it.
Stable, yeah.
They wrap around it.
Put pressure.
Impaled.
Pack around it and you stay.
Pack around.
Ever take it out.
That's an impalement.
Right.
It's a broken bone, so what do you do with that one?
Mobilize.
Stabilize.
You pack around it? You
Just cover it up, don't you?
Okay, yes, you would cover it up. And then what? Cover it with a damp cloth, and then what? It's still bleeding, so you control the bleeding.
Caroline,
Put some
can you
pressure.
please speak
Direct
up?
pressure. Nope.
No,
No.
Tourniquet.
Caroline's already broken.
not bleeding that bad. Just wrap it. Mobilize.
Okay, you could not put direct pressure on this because you can use your phone in order to do that. Okay.
Can't hear you, Carolyn.
Can you hear me?
No.
Hard to hear.
Barely.
Very far.
Slightly.
All right, can you hear me now?
No,
we
need to mute
everybody except Patrick, can you mute everybody, please, except for her? Crazy.
All right, yeah. I'm gonna remute everybody, and then Carolyn, just go ahead and explain the scenario.
Okay. All right.
Hold on, Carolyn. When I mute everybody, it's gonna mute you too. So unmute yourself after I mute everyone.
All right, I guess there's too many people to try to listen to answers from everybody with this many people. All right, in this case, you would cover it up with a damp cloth, but you still have to stop the bleeding. You can't put direct pressure on it because it's an open wound and the bones are sticking out, okay? So, but you would use a tourniquet above the wound. All right. Okay. The next one. Let me make this big again. Okay. This is a sucking chest wound. So what we would treat this one with a chest seal. Okay. This is where you put the plastic on 3 sides. Okay, you wipe away the pool blood and then you apply a piece of plastic and seal it on 3 sides. Remember, you apply it on the exhale. So when they inhale, the plastic will be drawn into the opening and it won't suck in air. Okay. This one you have a bleeding, a very bad bleeding in the armpit. So you can't put a tourniquet on that, so that you'd have to pack that wound. This is definitely a wound packing situation. And blood is spurting out, which indicates it's an arterial bleed. And look, she's also bleeding in her nose. That's not a life-threatening bleed, but to control a nosebleed, you just pinch it over the bridge and hold the person's head down, leaning forward, and just hold it until the bleeding stops. But the main thing you're concerned about is this armpit that you have to pack. This is a wound packing situation. Okay. This again, this is when you're just going to cover this up with a clean cloth and wrap it in plastic. Plastic it makes an occlusive dressing. Any kind of non-breathable substance like plastic or aluminum foil even you can use, but just cover it up so that it's not sucking in air. And this is not the one that you like a chest seal, but you just want to cover it up and get the person to the hospital. You can't do anything about that. You can't pack it because the blood vessels are all underneath all the organs, so you won't be able to find the blood vessel. So just cover it up and get the person to the hospital as soon as possible. Okay, this one you can stop with direct pressure and put a pressure bandage on it. This appears to be an exit wound. I'm not sure, but that's what it looks like to me. It could possibly be like a bullet went in and came out the back, but that's affecting the lungs. So you would use a chest seal, the same as you would use on the chest. You put it on the back here. Okay. Here's an example of use. You could use an Israeli bandage to do like they demonstrated on the neck wound where they lifted the person's arm up. And now you notice you put the bandage so that the pressure bar does not cover the trachea. You want to push it over to the side, but with the wound covered, but with the pressure bar on the side, not right under the neck. Okay, this looks like an internal bleeding. A very big bruise on the abdomen, that's an internal bleed. You can't do anything about that. Get them to the hospital. There's a nasty wound. This is actually a moulage that somebody did. I got a picture of it, but that's a nasty looking wound. But it looks like it's a pretty deep wound, so you would want to pack that. Okay, you pack it with a hemostatic gauze or any kind of clean cloth that you have, and then put pressure.
You wouldn't do a tourniquet and a quick clot?
A quick clot is a hemostatic gauze, yes.
Or would you also do a tourniquet? Both?
Well, if you could stop it with direct pressure, you don't need a tourniquet. It's not flowing, but it's a deep wound. So probably packing it would do the trick. If you can't get it to stop, with the wound packing, then go ahead and apply the tourniquet. But you could probably, this will probably work with wound packing.
If it's not bleeding, why are you packing it?
It is bleeding.
Okay, doesn't look like it's bleeding. Sorry.
That's because it's moulage. It's not a real thing. But yeah, it's a big wound and it is bleeding.
Okay, thank you.
Yuck. This is called an evisceration. The person's guts is spilling out. And in this case, you would just cover that up with cover that up. Oh gosh, with a clean damp cloth and get a person to the hospital. Don't push the guts back inside the body. They've already been contaminated, and you'll put the germs inside the body. Cover it up and get the person to the hospital ASAP. Okay. The only thing more tragic than the death is death that could have been prevented, and you learning how to stop bleeding can prevent someone from dying. And that ends my presentation. Okay. Now we'll open it up to questions.
So I have a question. Where does CPR come in? If you see somebody is unconscious, it's not clear if they're breathing, yet they're also bleeding. How do you order yourself?
You don't use CPR for bleeding at all. Use CPR if a person stops breathing.
Right, but I'm saying if the person looks like they're not breathing, you should do that first.
No, stop the bleeding first.
You want to stop the bleeding, otherwise you'll be pumping and pumping and pushing blood out. So the first thing you do is stop the bleed.
If someone's heart is stopped, they won't be bleeding. At least not spurting blood.
I'm trying to get this to come back up on screen.
There was a question about a possible skull fracture and using a pressure bandage. The answer is that you would not use a pressure bandage or an Israeli bandage on someone's skull if you suspected they had a head fracture. Thank you, Glenn, for that clarification.
Yeah, I'm trying to get my screen to open up here.
Are you trying to stop sharing?
Oh yeah, that's what I need to do. Stop sharing. Thank you. Oh no. Okay. There we go.
And Catherine, you're right. Wound packing is not part of the basic CERT training. This presentation is more of an intermediate level. It expands a little bit upon the basic CERT training. But the Stop Your Bleed is a national program.
Yeah, that's right. It's not part of the CERT training, but it's the Stop the Bleed. It's a national program, and they're pushing it all over because we've been having all these mass shootings and all kinds of other types of accidents that can cause a person to bleed out. And if you know how to stop it and you're there, do it. Okay. Okay. There are more questions, Patrick? You can read the question.
I have a question. I mean, it seems silly, but about I'm just looking at bandages right now. And I wanted to ask if what is best to have? Is that self-adhesive, or is it the one that's stretchy? Or I don't know if it's like a cost benefit or.
I like the self-adhesive just because if you get the sticky stuff, eventually it will dry up. The self-adhesive, you actually require very little of it to get it to stick. So you say put a non-adherent pad or a 4x4 down on someone, and then a couple wraps around, say, an arm or a leg with the self-adhesive or vet wrap. It's going to stick and it's going to stay in place pretty easily. And then you still have a lot more of that to use. If you use like an ACE bandage, it's more difficult because that doesn't tear and you have to cut it, and you need to really secure that with pins. So the self-adhesive bandage is my favorite.
Okay, thanks.
Patrick, any other questions in the chat?
Yeah, the Just a Compass does not appear to be an Android app. I think Carolyn has an iPhone.
I have a question.
Yeah, Doreen, go ahead.
Thank you. I was wondering, you showed a photograph of an injury that didn't look like it was bleeding, but she said wrap it and take it to the hospital. I'm wondering, what do you wrap it with? Because when everything you put on it stick to it? Is it gauze? What do you wrap it with?
Plastic. Which one that didn't look like it was bleeding?
The last one, and you said it was because of the type of photograph. You said just wrap it and take them to the hospital.
Yeah.
Someone even said it wasn't bleeding.
No, she said it was.
Yeah, but it didn't look like it was.
It was.
If the person's guts was spilling out, they're definitely bleeding. That just was a picture that I found that to demonstrate that. But
Yeah, my question is, what would you wrap it with? What kind of material?
a damp cloth or a piece of plastic wrap.
Oh, okay, thank you.
That's all. Get the person to the hospital. You can't do anything about it.
Perfect. Thank you so much.
Okay, other questions?
So there's a question here about, since this is not a certification class, is this considered within our scope of training? And the answer to that is, if you are cert trained, you should always try and expand upon your knowledge and training. This is something that is, the training that is in the cert class is very basic. We refer to it as the basic cert training for a reason. Basic first aid CPR is actually above the scope of cert training. You actually don't learn CPR in cert. So Stop the Bleed does, yes, go above and beyond the basic cert training. I encourage everybody to take additional training as you can. This is one of those. We're bringing this to you, but this is standardized nationally. So what you learn here, I mean, it's pretty basic. If you take a first aid CPR class, you also get these things as well.
I have a question too.
Okay, let me respond to that too, because the Stop the Bleed, you don't necessarily, you may find yourself in any situation not necessarily related to CERT, where you have to control bleeding. And it's just good to know what to do and how to do it as soon as possible to save someone's life. It doesn't have to be a CERT response. It's just a way to save lives. It's a national program that they're pushing out all over the country. And because they started out because of the mass shootings, and then we've had so many other incidents, and we have so many natural disasters where people get seriously injured. So if you're in any situation where a person is bleeding profusely, you need to know what to do to control it. And that's what this is for. Okay, not necessarily training, it's just a training that everybody should have.
My question actually related to the fact that this is not the complete training, so we don't have hands-on and we don't have a certificate. I have my CPR certificate, so I am officially trained. I'm just concerned that this is an introduction. It's not the complete information. So yes, I have lots of information here, and I feel like I can make a good start at saving somebody. But if there is a problem, am I considered to have gone outside the scope of my training since I don't have the certificate? Even though it's a national program, we're not certificated here.
Okay, the certificate that is issued from the National Council of Surgeons, I don't think it serves as a certificate like CPR does. It's just a certificate to show that you completed the training. But without the hands-on, you haven't actually completed the training. That's why I'm giving you the information. It's important information to have. But if this were a hands-on class, it would be intensive. We would stop with every different skill and practice it. So that's why I'm not issuing certificates, because we are not doing hands-on. But the certificate that's issued by the National Council of Surgeons is just issued to show that you have taken the training, but it's not like a scope of practice type thing, like CPR or first aid.
So, Valerie, the Stop the Bleed kits also include step-by-step guides and manuals. The answer to your question sounds more like you're wondering more from a legal perspective if you should even help somebody, put yourself at risk by helping someone. And the answer to that's personal. You really need to decide on your own if, because no matter what you do, no matter what action you take, you can always be sued from it. Even something like Good Samaritan says that, you know, you can't be held liable for rendering aid out of the goodness of your heart with no monetary compensation in return, as long as you do not exceed the scope of your training or your scope of practice. And the answer is they can still sue you. Even if you know what you're doing and you did it right, they can still sue you. It doesn't prevent them from suing you. So you always need to justify your actions. I encourage that this is an introductory, as Carolyn said. As soon as you can take an in-person Stop the Bleed class, do that. If you want to read a few first aid manuals on how to use a tourniquet and when to apply it and an Israeli bandage, I encourage that you do that. I can't answer the question if you feel like you're capable and confident to use these skills. That is up to you. And I would say that to anybody, even if you have been trained and you've been certified and you're an EMT, if you don't feel like you are capable of doing the skills correctly, then don't do them.
I agree.
I hope that answers your question, Valerie.
Yes, I'm the lawyer brain here, so I had to ask.
And it is a fair question. And for example, I'm an EMT, but I don't get much hands-on experience. I have not taken vitals in probably 3 to 4 years now. And I was working as an event medic, and someone alerted me to an incident. I arrived with my partner, and they had already called 911. So I knew paramedics were on the way. My partner asked me to take vitals. I knew that I was not confident in my ability to take vitals. And so I let my partner know I do not feel confident in doing this. I haven't taken vitals in a while. Paramedics are on their way. They'll be here within minutes. And I do not think I can get an accurate set of vitals that I am confident to hand over to the paramedics when they arrive. So that was a personal decision, knowing my level of training, my level of experience, and the situation. So it is something that you want to think about and understand that no matter what you do, you have to be able to justify your actions if things go wrong, or even if they go right and someone decides to take advantage of the situation.
Of course, the person bring a lawsuit doesn't mean they'll win the lawsuit if you're doing what you're doing in good faith.
Yeah, and clearly, if you're looking at this person, you go, I don't know what to do here, then maybe don't do something that you don't think is right. Any other questions?
You have another question, please, that relates to the packing?
Yeah, Elizabeth, go ahead.
Thank you. Do you actually spread the skin to get in as deep as you can?
If the wound is open, if the skin is already open, you just pack deep and you just push.
But you know what I'm saying? Like to get deep, you may have to actually spread it open. Do you do that? Okay. I'm thinking of a very thick gash, but yet the skin isn't gaping open.
I have a question about the apps.
I didn't hear the answer. I'm sorry.
Oh, sorry.
Elizabeth, you were asking, you don't spread it open. You just pack it. You just push down into the wound. just push down as hard as you can, but don't spread it open any further than it's already open.
There are courses you could take on that. There's methods that you learn, and as you know, you get into it, there's techniques you can learn that are better and on how to pack each wound. But
Oh, that sounds good. Thank
yeah,
you.
there are some classes on that you can find up and take. There are a few out there that are pretty good. I've taken one or two of them.
All right. Do you have any memory of what kind of what they might be called?
Message me, and I'll try and find the information and get that to you.
Awesome. Thank you.
You're welcome.
Linda has her hand up next, and then we'll go to the next person.
Okay.
Linda?
Hi, so
sorry, hold on. There's two Lindas.
Oh,
Linda
sorry.
Hoffman has her hand up, and then Linda Jensen.
Jensen, sorry.
Thank you. Thank you. I just wanted to make the point. I'm CERT qualified. I took the course before everything closed down. But I want to just make the point that learning this and learning what I did was because we are an earthquake country. And if we should have a serious earthquake, it's going to be up to us to help others, because the paramedics, the fire people, everyone are not going to be around to help us for a while. So forget certificates and think more of how we can help each other and save each other's lives. That's all I wanted to say.
Thank you, Linda. I agree. When we do trainings and I bring in an instructor to teach, I tell them I do not want you to teach to a piece of paper. And I don't want people attending thinking that they're going to get a piece of paper. You're there to learn the skills, and I want you to learn them correctly. I want you to learn them, and actually you will not pass one of the classes that I help put on if you are not proving that you know the skills, even if you paid for it and you're expecting a piece of paper out of there. The point is to learn the skills and do it correctly. Linda Jensen.
Hi, so thank you very much for your informative presentation first, and for the group for putting this on for us. I was looking earlier for the apps. I do have an iPhone. I do not find Stop the Bleed or Just a Compass. I already had 3 words for a while ago, but as far as an iPhone, under the app Stop the Bleed and Just a Compass is not there. I have a regular compass in my iPhone, but those two I do not come up with.
Just the compass, I'm not sure if iPhone has it. I know iPhone does have Stop the Bleed though.
I've looked 3 times. It doesn't come up.
Did you try searching for STB?
No, I spelled it out.
Some people in the chat said that's they found it under STB.
The link's in the chat.
I'll go back in the chat. There's a lot of stuff in the chat.
Yeah, I don't see Stop the Bleed or STB for Android.
I have Stop the Bleed and STB on my Android. I mean, Stop
Oh, and I take that back. I do find Stop the Bleed.
I just found Stop the Bleed for iPhone with just the initials STB.
I was gonna say, you could also probably find it through the website, the Stop the Bleed website. They probably have a link.
Did anybody find Just a Compass besides a regular compass in the iPhone?
I don't see Just a Compass for Android either.
I was looking for iPhone. I don't see that.
On Android, it's just called a compass.
A compass?
No, just compass.
Just compass.
And it has then this red arrow, the same one that she had on her sheet, and it seemed to be exactly that application, which shows not only the GPS coordinates but also the address associated with that with those coordinates. I installed it both on my Android phone and Android tablet just while we were talking here.
Can you put that in chat?
I actually put it in there already.
I see.
Did anybody find it for iOS? Because I don't see it with either of those, Just a Compass or Just Compass.
Can't help with that.
iOS, the only word is one word, compass.
Right.
Yeah, I already have compass in mine, but it doesn't give.
Is it black with a little red arrow?
Yeah,
Then you already have it. I think it comes with iOS.
but I don't know if that does your coordinates as well.
It has coordinates.
Okay.
Open it up, you'll see address and the coordinates at the bottom of the screen.
May not have an address.
Yeah, because they're saying it's got GPS. I already looked at the compass before I asked the question. It just says what degrees I am, 63 degrees northeast below, but it doesn't give anything else GPS wise.
It doesn't
That's the
say
GPS.
Los Angeles or
No,
elevation.
no.
Oh, mine does.
Yeah, mine does too.
Just compass doesn't seem to give me the address or the
Oh,
coordinates either, and it's got a ton of ads.
okay. So, sorry, when I put my location services on, then it brought it up because I don't normally keep it on. So because it's a tracking kind of tool. So when I went and just put location services on, then it does give the address or it gives it more distinct of where I am in Los Angeles elevation, but not an address.
If you live in Los Angeles, what 3 words is going to be a very good asset for you because LAFD is actually using what 3 words.
Yeah.
They have it embedded in their systems now. So if you call up and you tell them your what 3 words location, they're going to know exactly what to do with that. And in fact, they're going to send it to on their MDCs, the main data, the mobile data computers that all the firefighters have in their rigs. So if you live in LA City, that's the one you should be focusing on.
Yeah. I did that one a while ago. There was a show on where they lost somebody. They couldn't find somebody and they had that, and that's how they were found. So I downloaded it after seeing the show.
Okay. Any other questions?
I just want to state one other thing that I noticed that during the thing, when you guys apply a tourniquet, there actually is a time slot right here on the tourniquets, on most of them. So you can actually apply the time on there so you know, and first responders also know that there is what time it was applied. So that's a big thing too. Make sure you guys apply that.
Oh, I do want to mention that be very careful about where you buy your emergency supplies, like a tourniquet. There was a big thing on eBay, big scandal on eBay that there were these knockoff tourniquets from China, and several first responder agencies actually bought them, and they failed in the field, like they broke. So if you're going to buy what was demonstrated was a combat applicant tourniquet or a CAT tourniquet.
Here's one of the fake ones.
That one is from North American Rescue. Make sure it's sealed in bag with the instructions.
Not only that, a real CAT tourniquet will also mention that it is a CAT tourniquet on the inside right here.
Yeah. And you want to look for the Generation 7 tourniquet, CAT tourniquets. What they did from the Generation 6 to the Generation 7 is they increased the size of the windlass. They inverted the ribbing on it, so it's easier to grip with gloves and when it's muddy or bloody. They also changed it. The previous versions, you actually had for a leg injury, you actually had to run the tourniquet, the strap through twice, and that is not done in the newer tourniquets. So if you're going to look for one, make sure you get the Generation 7 or newer tourniquet.
And I would suggest that not only the time, but put the date as well.
Well, it's only within hours that that's going to be there. You don't realistically need the
It's
date.
viable, but it's, I don't know, that's just what I was taught. Always put the date. Just in case you're at 11:55 and they get there at 12:07.
Good idea.
In that situation, I could see it. Yes.
For the Israeli bandages, it's a more of a curriculum. The term is the Israeli bandage nomenclature is because the Israelis do actually have a bandage that they issue. And if you look on eBay, you'll notice that some of these, when you type in Israeli bandage, will have Hebrew written on them. The US version is referred to as, it's actually printed, the emergency bandage. And they come in different sizes. I believe there's an 8-inch and a 6-inch and a 4-inch. There are sometimes two versions of it, one with the plastic pressure bar and one without. So if you're going to be looking for that, make sure you get the one with the plastic pressure bar.
And it comes in, it comes shrink wrapped in a sterile package. So there's a sterile package inside of it. Yeah, the external one. If you open that up, is also a sterile package. So it's sterile when you.
Okay, you're opening it.
Yeah, so you pack it. Pull that out, Pat. Yeah, when you pull it out, it's also inside of another plastic, wrapped inside of plastic to hold it. Anyway, it's sterile, so it's okay to use. If you want to use a tourniquet, if you want to buy a cheap tourniquet just to practice, get one just to practice and don't use it for anything else. But if you want to have a tourniquet that you're going to actually use to save somebody's life, you want the real thing. Okay.
And be careful when you're practicing not to turn the windlass too hard. Only a couple turns just so they can feel it. But don't push beyond that. When you buy the emergency bandage, comes with an inner and outer packet. The outer packet has the instructions on it, and the inner packet is sealed. Of course, I don't have it on there, but just keep that in mind. If you think you're going to rip open the outer package and you have a bandage ready to go, there's a second bag that you're going to have to cut open or rip open to get to the bandage.
That I really like that Israeli bandage. It's I find it really useful.
Oh yeah.
It creates the pressure that you need to hold something, hold pressure on a thing, and even like I said, 90% of bleeding can be controlled with direct pressure if you use the proper method. So go for it.
Yeah. One thing that wasn't mentioned, and this usually comes up in first aid classes whenever we start talking about tourniquets, is there is the belief that someone is going to lose their limb if you put a tourniquet on there. It's the old teaching. That has not been the standard teaching for the last at least 10 years, probably 20 years. And the reason for that is, one, first of all, if someone is bleeding severely, I'm talking about spurting blood out. If you delay putting a tourniquet on there, they will probably bleed to death. They will die. So if you're concerned about them losing their limb versus losing their life, your priority is wrong. Additionally, based on all the medical training and knowledge, especially from battlefield wounds, they have come to the realization that you can have a tourniquet on someone for hours before you put risk of them losing their limb. So if you live in LA City and you know that the fire department is minutes away and someone can bleed to death in minutes and the hospital is minutes away, then I would not delay putting a tourniquet on anything I saw spurting blood, bright red blood, because I know that if I don't do something very quickly, they will die. If you're out in the woods and you are hours away from a medical lift, like a helicopter taking someone, then you have additional concerns about that. But if you're also in a disaster scenario and someone is, you're not going to get to the hospital in days, then that is something to consider. But you want to look at how bad that injury is, how badly are they bleeding, and how quickly you need to do something about it. If you take too long and they are literally spurting blood out of a femoral artery, that's the artery that runs down your inner thigh, that could cause someone to bleed to death within minutes.
Right. And arterial bleed, remember, is one that spurts. It's under pressure, and every time the heart pumps, it's pumping blood, and it'll spurt out. That's how you can tell if it's spurting blood. You know the person is in big trouble. So you need to stop that ASAP.
Yeah. And the way I approach it, if I see someone spurting blood, I'm going to be thinking, I need to put a tourniquet on this, I'm going to go and attempt direct pressure immediately on that wound, try and at least slow it down while trying to figure out how I'm going to get a tourniquet to them, on them. I would not go in with the mentality thinking I can stop this arterial bleed with direct pressure and that I need to wait before I apply the tourniquet. I would be immediately trying to think about how I'm going to get that tourniquet on there. But of course, you're going to do the direct pressure first because it's going to slow the bleeding. There was a hockey player who, you see the video on YouTube, he's skating and someone goes up on one leg and his skate cuts right across the guy's neck, cuts his carotid artery. And he immediately grabs him by himself by the neck, puts pressure on the wound. He can't stop it, but he's able to slow the bleeding enough to get off the ice. And they had a surgeon there, a doctor for the hockey league, who was able to save his life. So that direct pressure is the first thing you want to do, but you want to start thinking about what is next and how quickly do I need to accelerate what I'm doing. Direct pressure first, yes, absolutely. But what now? A pressure bandage or tourniquet, or do I actually think I can stop this with direct pressure?
Yeah, pressure bandage is direct pressure.
Yes, that's true. Clarification on that. Do I think I can stop it by just exerting direct pressure with my own hands, or do I need a more commercial or an alternative that is going to put continued direct pressure on that, or possibly more direct pressure than I can keep putting on it?
Yeah, definitely. Add a pressure bandage to that.
And remember, if you're putting direct pressure on something, you can only do it for so long. Even if you're putting your entire weight behind it, you're eventually going to get tired and you will let up on the pressure. And that's actually really bad, because if you've actually managed to slow the bleeding and start clotting, and then you let up on the pressure and it's an artery, it will reopen that injury and blow through the clot. And now they're bleeding at full strength again. That's also why you never want to check if you put direct pressure on with the bandage. You never want to pull the bandage off and check to see if it's still bleeding. You keep that bandage there because of the clotting that has happened. As soon as you pull that bandage off, you can actually rip the clot.
Yeah, and if it's bleeding through the bandage, just put another one on top of it. Don't take that one off.
Absolutely. For the tourniquets, the tourniquet is only removed by a surgeon at the hospital. So as soon as you put a tourniquet on, you leave it there.
Absolutely. Don't take it off. Don't take it off and don't loosen it if the person is uncomfortable. Keep it
yes
as tight as you can. Keep bleeding. Because as soon as you loosen it up, the bleeding will start all over.
Exactly. All right, Glenn, did you have anything to add? All right. All right, then if there's no other questions, thank you, Carolyn. Thank you for everyone attending. We hope you learned something. We hope that you are encouraged to take more additional training and get hands-on practice as soon as you can. And hopefully you can save someone's life. Hopefully you don't need to save someone's life, but hopefully if you're put in that situation, you can save someone's life.
Better know what to do and not have to use it.
Yeah. What I say is that all bleeding stops eventually. Don't do something and they're bleeding from an artery, it will stop, and that is a bad thing. If you do something and you're able to stop bleeding, at least long enough for them to get to the hospital, that's a good thing. And if they lose consciousness due to pain or to loss of blood, and that's very much a case, then you keep doing what you're going to do. Don't let them losing consciousness stop you from continuing to render aid. One thing that actually did not get mentioned, and I should have caught it earlier, treat for shock. If someone has lost a lot of blood, they are going to go into shock, and they're not going to be able to thermoregulate, and that can actually kill them just as much as the loss of blood will. So you want to make sure you keep them warm, you keep them protected from the elements. So if they're laying on a ground, and this is why Carolyn has the emergency blanket in her kit, if they're laying on the ground is going to leach heat away from them. So put something underneath them. Don't put them directly on the ground, and cover them. And so actually having 2 emergency blankets is a good idea. One to put underneath them and one to put over them and around them. If you put a tourniquet on them, they need to go to the hospital. If there's no hospital, do what you can with what you have, but try and get them to the hospital, because no one can remove that tourniquet except for a surgeon at a hospital.
One last thing I'd say is the thing of hot hands.
Yeah.
These are great for heating someone up too, and you know, using it with the emergency blanket.
Be careful about that, just so you don't burn them, because if they're not thermoregulating, they might not actually know they're getting burned.
Or you don't put this directly on the skin. You put it, you know, between clothing and the armpits or something.
Get that hot that they would burn?
What some people, you need to be careful about, there's the reason why there's actually the toe version and the hand version. If you put the hand version in a shoe where there's lack of oxygen, it will actually get hotter than the ones designed for shoes that are designed to go in with lack of oxygen. So yes, you can actually burn someone with those.
They can get up to like almost 200 degrees if you're not careful.
I didn't know that. That's what the hand warmers do.
They're average 135 degrees, but they can get, if you, like Patrick was saying, they can go upwards of almost 200 degrees up to there, you know, with the heat. So you can burn someone easily.
And I've never kept those in my pack because I just never thought we'd have use for them in California. It doesn't get that cold.
You haven't been to Rose Parade lately, have you?
Right.
Where do you get those?
You can buy a box of these over on the hand warmers on Amazon or wherever. You know, you can get them at like Sam's Club or something like that. They're all over.
Big Five, Walmart.
Survival store, SOS.
Yeah, Big Five and Walmart also carry them.
Oh,
Yeah.
great. Okay. Thanks.
Then the survival blankets you can get from like North American Rescue or, you know, one of those other places that have stuff. North American Rescue has a lot of good prices on stuff.
All right. Thank you, everybody. You have a good evening. And we'll see you back next month. We don't know what the training is for next month, but it will be the 3rd Wednesday of the month.
Thank you.
Oh, I do know that
This
it's
was
gonna be
so
search
great.
and
Thank
rescue.
you so much.
It'll be on search and rescue next month.
Ooh. Oh, yeah, that's right.
Good job, Patrick.
Thank you. Really, really great. Thank you so much. Good night, everybody.
Thank you. Appreciate it.
Adam, if you stick around a minute, I have a question for you.
Yeah, of course. I always stick around to the way end.
Thank you, guys. I happened to sit on another Stop the Bleed that was, I think, might have been through Aries, and this was, I thought a little more comprehensive. I was impressed.
Good job, Caroline.
I just added the Israeli bandage and I added the pressure bandage because that's what the pressure bandage we learned in CERT, but the Israeli bandage we didn't. But that I think that's such a cool tool, excellent thing to use to stop bleeding. I have several of them, and yeah, they do come in different sizes. You can get them 4 inch, 6 inch, and I think 10 inches. Very
The 10-inch would be the abdominal version that folds outwards.
Yeah, that's for abdominal version, right?
Yeah.
Adam, you mentioned earlier, and I'm trying to remember what it was. It was some kind of training about wound packing, right? Is that what it was?
Yeah. There was a training. I've taken 2 different courses on them. And they taught us how to do different packing. So they taught us first off, you know, how to tie the knot on the end, find the wound with your finger, push it, the knot and everything down to the wound, and then keep that finger in there and then slowly pack around the wound and fill it up all the way so you get it nice and tight in there, very compact. And then that way, when you put the compression on top of it, there's no extra room in there where it can expand outwards and other things afterwards, preventing the pressure on the wound and all of that. So I'm trying to remember where the courses are, like what they were, but I got to look them up. I remembered last month with my TC3 training, they did that, they refreshed over that. And then I had another one that I took before. I'm trying to remember the organization I got it from, but I was very interested in those courses.
Okay, anyway, hope you all found it useful, and if you get a chance to take a hands-on, by all means do, because it's well worth the practice. And it's better than theory any day. But you have some basic knowledge of what to do.
Absolutely. All right. Thank you, Carolyn. Thank you, everyone. Have a good night.